building resilience, and transforming healthcare towards sustainability. Our objective is to dialogue and advocate for the increased generation and use of disaggregated data, the full protection of essential health workers, and the acceleration of care economies beyond COVID-19. There is no doubt about the relevance and importance of this topic, and more so it will be enriched by the contributions of our distinguished panelists who have been convened today. Without further ado, I would like to invite our Deputy Director, Mrs. Mary Lou Valdez, for the welcoming remarks. Mrs. Valdez has an extensive experience in the field of public health. Under her leadership and guidance, we increased our collaboration with partners to advance public health in our region, with special attention to gender equality and health, a topic with which she is fully committed. Madame Didi, the floor is yours.
Thank you, Gina. Let me just make sure hold on. Thank you, Gina. Good afternoon, everyone, and warm greetings to all. Welcome to our panel on gender equality and health, using evidence, building resiliency, and transforming healthcare towards sustainability. It is my honor to greet our distinguished panelists. First, Director of the Secretariat of Care and Disability of Uruguay, the Honorable Dr. Karen Sass. Ambassador and Permanent Representative of Canada to the Organization of American States, the Honorable Hugh Adsett. And of course, PAHO's own Director and Assistant Director, Drs. Carissa Etienne and Jarvis Barbosa. Together, they will share their expertise and experiences as leaders in our region. Our underlying theme is ensuring gender equality in building back better and transforming healthcare towards sustainability post-pandemic. Today, on International Women's Day, we are acutely aware of the many challenges we have faced and are facing due to COVID-19 and its impact on our populations, communities, and families. While this year is being viewed as hopefully a recovery from the coronavirus pandemic, we cannot forget the profound shocks left in its wake. This public health crisis has led to unequal and severe economic and social impacts to global development and well-being. PAHO and the region's leaders have had to intensify efforts putting health and gender inequities at the forefront of national attention. Our report on gender analysis of COVID-19 reaffirms that women have been disproportionately impacted by the pandemic and that gender inequalities persist in the Americas. Now that health leadership has occupied the global stage, there is greater urgency for that leadership to be inclusive and representative of the needs of diverse women. While early in the pandemic, energies were focused on surveillance and intensive care units, the current focus of national debates are now on essential issues such as health system resilience, wider healthcare needs, and the care economy. The increasing burden of care on women is a significant gender concern of the public health and social crises. We need a future where care work does not fall disproportionately on women's shoulders. Evidence show that women are at the heart of the pandemic and should be at the center of the responses at all levels. Indeed, women are essential in responding to the health crisis and for the attainment of universal health coverage. So as we observe International Women's Day, we must ask ourselves, how do we accelerate gender equality with sustainability? One way is to be better prepared for what is the inevitable future pandemic. Another is for leaders at all levels to be committed to tackle the threats of persistent inequalities in access to healthcare. Simply put, unless we put gender equality at the center of our recovery efforts, resiliency and sustainability in health will be forever threatened. We must build more gender equal, resilient, and sustainable societies. Governments need to develop policies not for women, but by women, with their full involvement and at the heart of recovery. As PAHO and its member states celebrate in 2022 our 120th anniversary this year, equity, gender, and diversity must be well integrated into our policies, decisions, and actions. Today and together, we celebrate International Women's Day. I extend solidarity to all women and girls. Thank you for joining us, and thank you to my PAHO colleagues who have helped to make this event possible. Thank you, Gina. Back to you. Gina, you're muted.
Sorry, this little thing always gives me a problem. My apologies. Thank you, Didi, for your insightful remarks and for clearly identifying the relevance and importance that the topic of gender has for PAHO, together with equity, one to which there has been strong commitment, and of course, the whole context of COVID and its challenges that further puts a way forward on how this organization is advancing. And it's advancing under the direction of our esteemed Dr. Etienne, who will be launching today the report Gendered Health Analysis, COVID-19 in the Americas. While Dr. Etienne requires no introduction, I would like to mention in her character as Director of PAHO, she will present a synopsis of our new report mentioned before. Under her leadership and strategic guidance, the organization achieved some noteworthy milestones during the recent years. Some examples are the successful preparedness and response to the epidemic and the COVID-19 pandemic, the elimination of several transmissible diseases, the prevention and control of chronic non-communicable disease, ensuring gender equality approaches, and the strengthening of national health systems and services towards universal health in the region. Efforts for which this organization is very grateful, and I am most pleased to welcome and hand over the floor to Dr. Etienne. Madam Director, the floor is yours.
Thank you so much, Gina, for being really so gracious, and thank you for leading our unit at this particular time. So let me warmly greet our very distinguished panelists, Excellency Ambassador Hugh Adsett, the permanent representative of Canada to the Organization of American States, Honorable Dr. Karen Sass from Uruguay, Mary Lou Valdez, our Deputy Director, Dr. Jabez Barbosa, our Assistant Director. Let me say that really it's an honor to be sharing this virtual stage with you. I want to warmly greet our attendees as well, and to thank you for joining PAHO on International Women's Day. Let me take this opportunity also to say Happy International Women's Day to the staff of PAHO, especially our women personnel, but let me also give a shout out to all the women and girls of the Americas. Our development is truly in your hands, and it is our wish that you will be at the very center of the development that we so aim for in this region. So I am particularly pleased to be here to discuss an important PAHO priority and an issue that is core to the development of our region. That is advancing the agenda for gender equality and supporting women's health. Today, PAHO is releasing the Gendered Health Analysis on COVID-19 in the Americas report and exploring the effects of the pandemic on women and girls. I think this is significant in our 120th year of serving the peoples of the Americas. At the end of 2020, we started this effort to identify how gender and other factors were affecting our people during the pandemic. I wish to recognize the team that contributed to this pioneering effort and to acknowledge the insight of the key informants who collaborated to produce this new evidence on gender inequities. This report underscores that gender inequality is an ongoing social, economic, political, and health crisis, one that has been exacerbated by the pandemic. But it also highlights where we need to work harder to create a more equitable, resilient, and sustainable future, one where women can equally participate in the formal economy, experience pay equity, be protected from violence, and live healthier, more balanced lives in and outside of the home. I want to specifically highlight the report's findings across 3 tracks: women's employment, social well-being, and health. Even before COVID, nearly a third of women in Latin America and the Caribbean had no income of their own. But the pandemic has made things worse for women across all sectors of the economy. When COVID shuttered restaurants, those who worked in kitchen and as waitresses saw their jobs shut down and even evaporate. As travel came to a halt, women who worked in the hospitality industry as hotel clerks, housekeepers, and resort workers lost their jobs. And as markets closed, those who relied on informal jobs lost their source of income. Young women, Indigenous women, and Afro-descendants were especially affected. Women are very often our social safety nets. Their labor sustains families, supports economies, and fills gaps in health and social services. But this work is often unpaid or totally unrecognized. During the pandemic, women's roles as caregivers put them at even greater risk of illness. As a vast majority of our health workforce, women were at the front lines caring for COVID patients, and they accounted for 72% of all COVID cases among health professionals. If better protected from the beginning and with reasonable shifts, accidents could have been prevented and infections obviously could have been prevented. The physical and emotional cost of working long shifts at the hospital or being exposed to COVID followed them home, where women are also responsible for 80% of the household work. Several studies have shown that women in healthcare were more likely to experience anxious and depressive symptoms, insomnia, or burnout than their male counterparts. But it wasn't just our health workers who shouldered additional stress and who faced psychological duress. As countries enacted lockdowns to slow the spread of the virus, women were spending more and more time at home. And for too many women, home was not a safe place. During this period, calls to the domestic violence hotlines soared by some 40%, and survivors faced new barriers in seeking help. We are also seeing that post-rape care has been particularly disrupted during the pandemic, leaving survivors at higher risk of HIV and other sexually transmitted infections, mental health illnesses, and forced pregnancy. COVID has had a staggering impact on women's health. Even though women are slightly less likely to develop severe disease than men, data from our study shows that women were more likely to be diagnosed later than men. And when they were diagnosed, they died earlier than their male counterparts, suggesting that more women didn't get the right care in time. Some studies show that Afro-descendants, indigenous and rural women, and migrants are at greater risk due to overlapping gender and social inequalities. Data from Mexico shows that COVID was more likely to be missed in young indigenous women, leading to higher rates of illness and death as compared to other age and ethnic groups. As countries restricted travel and much of the health workforce was channeled to the COVID response, too many women and girls were left without the support that they needed to remain healthy. In Latin America and the Caribbean, 1 in 4 adolescents did not have access to family planning services. When adolescents lack access to the tools and services to plan their families and their futures, they are left vulnerable to unintended pregnancies that not only bring significant health risks, but also raise the likelihood that our girls drop out of school and remain trapped in generational cycles of poor health and poverty. Indeed, COVID has worsened one of our most persistent challenges in this region, which is maternal mortality. Expectant mothers had to balance the fear of COVID with the uncertainty of not knowing whether they could safely deliver their babies at a health facility. And too many did not get the care that they needed in time. We saw that in the United States, where maternal mortality began to spike after August 2021, when hospitals were overwhelmed by the Delta variant. Today, we also know that pregnant women are among those most vulnerable to COVID-19 due to changes in their immune system that can put them at risk for severe disease. Over the past 2 years, more than 365,000 cases of COVID-19 have been reported in pregnant women in the Americas, and over 3,000 of them have died. This is a tragedy, especially now that we have safe and effective vaccines. We must address these deep-seated inequities in our region to face the current health crisis and to build a brighter future for women and girls in our region. Women must be supported to fully participate in our societies. We need to ensure that women are adequately recognized, supported, and compensated for all their labor. Countries should also implement better care policies to recognize women's work, especially for those who are taking on the double burden of labor at work and labor at home. Many countries had social safety nets that helped households that were struggling with finances, but few nations address the issue of women's unseen work in the informal market and at home. At the same time, we must shift gender dynamics in our societies to promote a more equal sharing of household work. We must also ensure women's right to health is protected now and into the future. Countries must ramp up access to family planning services, pregnancy-related care, post-rape care, and routine checkups. These are life-saving health services that women and girls depend on. We need to make up for the missed opportunities, appointments, and care that were delayed during the worst phases of the pandemic. We need programs that cater to people living in the most vulnerable conditions, such as minority women who are too often left behind. We must ensure all our health workers are vaccinated and protected so that those on the front lines would be protected. Every woman of reproductive age, including those that are already pregnant or who are breastfeeding, should have access to vaccines. And that is why it is especially important that health workers listen to women's voices and talk to expectant mothers about the importance of getting vaccinated to protect them and their babies from this virus. Improving access to COVID vaccines for women is a concrete step that we can and should act on right now. And lastly, women must be a part of the pandemic recovery and the response to all future emergencies. Women must be at the table. Across the Americas, women make up only 30% of COVID response task forces, yet over our national strategies. To make progress against COVID, to recover gains lost across immunization, malnutrition, family planning, and other health challenges, we need to put women and girls at the very center of our efforts. Doing so will shape not only how we come out of the crisis, but also how we better prepare for the next one and how we better prepare for our own development. We must ensure that women are an active part of the recovery effort. This report is a clear call that to create more resilient, just, and healthy societies, we must build a more gender equal world. Thank you for all of your efforts. And I look forward to the time when our women will be present not only in caregiving and household chores, but that increasingly our women will take the reins of development in our countries in every sphere, and that we can together develop and lead healthy lives and enjoy well-being. So thank you so much again for listening.
Thank you very much, Madam Director, Dr. Etienne, for your timely, insightful contribution to this day. The clear identification of roles, challenges, risks, and unequal conditions that our women or girls or adolescents or daughters and grandmothers face and have faced for a long time, but more so during this pandemic, is no doubt one of considerable concern. But more so, I want to thank you for your commitment and for your clear indications on the way forward to recovery, response, and preparedness. The women in our region will have a debt of gratitude with your leadership and your guidance during these difficult moments, unexpected moments, but also in the way future to the public health of our countries and our member states. Thank you very much. I would now like to invite the Honorable Dr. Karen Sass, and I will switch to Spanish. Dr. Karen Sass is directora de...
Dr. Karen Sass is Director of Disability at the National Secretariat for Disabilities and Care in Uruguay. Previously, she was responsible for the regulatory division. She has a PhD in law and she has a degree in social work. She is leading the design, development, and implementation of public policies and programs on disability at the national level. She coordinated a national strategy to promote health, and she was charged with coordinating projects for healthy municipalities in all departments in her country, as well as in the Ministry of Public Health. Dr. Sass will be sharing with us some reflections around the issue of justice, economics, and the issue of health. Dr. Sass, the floor is yours. Hello and good afternoon. It's a pleasure for me to be part of this event, and I would like to take this opportunity to send my greetings to this panel of experts. Undoubtedly, today is a day of reflection. All of the countries represented here today are gather around one topic. And in my case, I'm going to talk about economic justice. But before that, I would like to talk about the institution itself that I work at, which is the National Secretariat for Care and Disability. I am now going to share my screen so you can see my presentation.
En primer lugar, quisiera hacer referencia.
First of all, I would like to say that the National Secretariat for Care and Disability is part of our Ministry of Social Development, and it has two different divisions, one that has to do with care and the other one that has to do with disability. The idea of this presentation would be for me to talk to you about, on the one hand, the issue of care, and on the other hand, the issue of disability, gender, and some other health-related aspects, which I believe are highly relevant in the framework of this conference and also in celebration of this International Women's Day. To begin with, I would like to talk about the unit of care, the Office of Care, that has a system that has the Secretariat for Care, but also the Advisory Council, which interacts with civil society and focuses on care. We have a National Care Board that all of the public agencies that are involved with the system of care are represented there as well. Why are we talking about a system of care? Well, undoubtedly, in order to reduce gender inequality and to work on economic justice, we have to talk about care. Through the different studies that have been done all over the world, we had confirmed that the lack of care services, whether it's childcare services or housework, we see gender inequality, and it prevents women from actively becoming engaged in the labor market. So we need to have quality care services and shared responsibility so that the burden of care could be the burden of care should be shared. That has to do with inequality between when men and women, but also the shared responsibility that we see in our societies. Now, what are some of the restrictions that women face? Well, on the one hand, some surveys show that use of time and the amount of time that women spend doing unpaid work. Oftentimes, it has to do with the burden of care itself, which also, of course, impact that. So sometimes we have issues women joining the workforce, and on the other hand, they have precarious opportunities resulting in informal job opportunities, which also create inequalities between men and women. When there are no safety nets, these issues come up, and therefore working conditions make them more vulnerable. So it is indispensable to talk about inequality based on discrimination that women face in the workforce. We still have a lot of gender stereotypes, and we have the ideal worker and the whole issue of family responsibilities. And whoever has family responsibilities, there's negative impact in their ideal worker profile. So we need to have a more equal footing for everyone, and we need to work on the issue of gender. Today, in a celebration that we held today to commemorate International Women's Day, the theme was women's economic autonomy, and a lot of strategies that have been worked on were presented by the government in order to make progress in closing this gap. But undoubtedly, there's a cultural issue that's highly embedded and that requires a lot of work in order to see significant changes in terms of the women, the roles play in our society, because unemployment rate among women continue to be higher, because women continue to have lower income for equal work, and all of this, of course, impacts inequality. But going back to the issue of why we need a care policy, Well, because first of all, we need to acknowledge unpaid work and the amount of time that takes away from women's time, which of course prevents them from having a full-time job or sometimes have twice as much work between their former work plus unpaid work at home. In order to do that, we need to acknowledge uh, with clear government policies in this regard that we need actions that will lower that unpaid workload. So on the one hand, we have a lot of services that focus on early childhood, which is a priority for our country. That is to say, to have some policies for early childhood, but everything that has to do with maternity and paternity leaves, better and stronger strategies and policies on shared responsibility for care, as well as shared responsibility between the marketplace and businesses, which of course also have a major role to play in this transformation. So going back to our definitions, this national care system that we have in Uruguay was a result of a gender policy that enabled Uruguay to make progress in this issue that has to do with distributing this unpaid work. Care is a right that is very important to highlight. And of course, it plays a major social role that has to do with the person's autonomy and assisting people that are dependents. The core of our care policy have to do with a target population that is dependent. And later on, I'm going to make a distinction between dependency and disability because those are all two major aspects. So it's a series of actions that society carries out in order to have comprehensive development and daily well-being of people that are dependents and who need help from other people in order to carry out with their daily activities. Now, what's the purpose of this national care system? To develop, promote, and implement policies aimed at people who are dependent and to ensure access to quality care. This means that there has to be shared responsibility between the government, society, the market, and community. And something I would like to highlight is that this policy was voted on unanimously by all of the political parties that we have in our Congress. This began back in 2015, and in spite of the different changes in administration, this policy is highly rooted with its own budget allocation to be able to implement this policy because of how important it is. The target population for this national care policy are the people that require this type of support in order to carry out their daily activities, which are children up to 12 years old, people with some kind of disability who are not autonomous to perform their daily activities, and people over the age of 65 who also depend on somebody else. This is our target population. These are the groups of people that need the highest level of care. And since women tend to be the caregivers, they are the ones that we want to support, not only to ensure that quality care is given, but also, as I was saying, to develop policies that are gender-based and that focus on creating equal opportunities in the marketplace so that women can truly be included in the workforce on an equal footing. So as I was saying at the beginning, we have two directorates or offices, one for care, one for disability. And here I would like to clarify these concepts because oftentimes we confuse dependency and disability, but they are two completely different concepts. And that is why I would like to focus on what the Office of Disability does. It focuses on obviously people with disabilities, and it has to do with the social construct of disability. So basically there's an interaction between two components here. On the one hand, we have the people that have some kind of disability, and on the other hand, we have all of these attitude or behavior-based barriers that prevent people with disabilities from fully becoming engaged in the society in which they live. Why is this so important? Because obviously employment is one of the major um, aspects of any kind of development. And when we talk about difficulties for women accessing the workforce, when we add disability, then it becomes even more difficult. People with disabilities are lagging behind. Even the people with disability themselves and their families do not believe that they have the right to be included in the workforce. So when we talk about changing this cultural behavior, here we have something very important that has to do with taking down all these behavior-based barriers that emphasize disability and prevent people from being fully included in society. And of course, we cannot talk about economic autonomy when the person with disabilities does not have many other rights. And when we talk about this, we need to focus on bearing down the barriers so that people can be fully integrated. So as I was saying, the social model for disability obviously has a human rights focus, and it has some main assumptions. Disabilities has nothing to do with religious or scientific aspects, but rather these are assumptions that are merely social. What the Convention on the Rights of the People with Disabilities focus on how the environment impacts the definition of disability itself, leaving aside the fact that has an individual component to it. And this social model also breaks away from the traditional conception where disability was associated with disease. We need to work on a model based on support to create the necessary conditions so that people can be fully integrated, and we need to focus specifically in the workforce. And of course, different types of support are needed. For those of us that have been working on this, on including women with disabilities in the workforce for a very long time, know that one of the main barriers that people with disabilities face when trying to join the workforce are their own co-workers. So there are some prejudices and stereotypes that somehow prevent that person from being fully integrated because they're not perceived of being fully capable. So here there's a key role that all governments must play. And the convention that I mentioned, which is like a true north, talks about making society aware and to take immediate action at the government level in order to move towards this full inclusion. It has to do with making society aware of all these rights, including the family. So we need to have a focus on rights, equality, and inclusion of people with disabilities to encourage recognition for the dignity these people have. And obviously this has to do with having this human rights approach. We need to fight these stereotypes and prejudices because these are the ones that prevent people with disabilities from being included in the workforce, but also to access quality jobs and to be equally considered for certain job positions. Sometimes there are certain prejudices that are associated with persons of disabilities, and the conception that certain persons with disabilities not being able to perform certain roles. Uh, and another aspect that we always mention is that persons with disabilities historically live with he or she can't do it. So anywhere they go, that's their first response. He or she can't do it. You know, this happens in education, in health, in workforce. So the ongoing struggle that we have is to try to move away from this model and just look at what the persons are able to do.
específicos.
Now,
Nosotros en nuestra
sometimes that requires specific support. For example, we have to make certain that these people can work in a favorable labor environment. But there is something else that has to do with each person's own abilities. And people have to be able to realize that vision.
vinculado a este tema,
So linking this issue, requires introducing the issues of gender and violence, and I wanted to refer to health and also refer to how the pandemic has caused access to certain things to been more limited for persons with disabilities. So I was talking about breaking down the stereotypes and the prejudices that are related to men, women, or girls with some disability. Because sometimes when we see that disability, we forget other things that have to do with that person. And a lot of this applies to gender equality. So if we see a person with a disability going to a health service, it would seem that that woman is a woman with a disability, and they forget every other area of her life. Is she working? Is she an Afro-descendant? And we just focus on the disability. And the same happens to women with disability. They give up their gender identity often, and they feel that they are more identified by that disability than anything else.
Por esa condición. Entonces, acá sí me parece importante.
Here, I think it is important to look at the role played by health staff and health services. This is something where historically persons with disability
Con discapacidad, el único lugar donde acceden son los lugares vinculados a la salud.
Have access basically to these healthcare services. That's the only place they go. So it's important to have the health workers talk about other areas other than the disability. Here, the Pan American Health Organization has been an important partner for Uruguay in many areas having to do with gender and disability. We have a project that we're working on, and it had to do with discrimination against women with disabilities. And there were many courses, many training sessions that were offered for healthcare workers, also manuals about how to deal with people with disability. So change agents are to be found everywhere, but definitely in the area of health, we have a privileged position. Often persons with disabilities find that first place that they access to deal with questions related to violence, for example, where there are other state services that could work with them in addressing those issues. So in terms of the intersectional approach, I think it's important that we look at the need to support young girls as they become women. Now, here I was referring to access, and definitely the way that information is provided is essential so as to help the person we want to help. Here we have things like interpretation of sign language, things having to do with a language that can be used by persons with a mental disability. So it's important that all this information reach the target person as we want. Also, the right to choose a partner and to do so in keeping with the person's own wishes. Now, I put this on the slide. It seems to be something obvious, but for the person with a disability, this is not always seen as being obvious. Her sound froze.
Sobre la mesa porque desde cualquier ámbito.
So this has to be put on the table because anything having to do with disability, sometimes we think that decisions can be made for that person. And often one of the first changes that we have to produce is ask that person questions, listen to the answers. We have to listen to what it is that person wants to do. And then there is something else here that has to do with nurturing. We are engaged in a pilot experience here in Uruguay, and it has to do with providing strategies for nurturing, for child raising. And Here, this has to do with disability and gender equality. Often, persons with disabilities aren't given the right to decide whether or not they want to have children. Often this is discussed in healthcare agencies. They begin to see something that catches their attention, and then decisions are made having to do with raising children or even taking those children away from the women with a disability. That is why we did a study and the Pereira Rosell Medical Center. It's our center of reference that has to do with maternity in Uruguay. And they worked on one of the specific issues that I already mentioned, and that is, what do we need to do as countries so as to come up with a social model for disability and tearing down the different obstacles that stand in the way of a complete inclusion of women with a disability. Now, there are stereotypes, prejudices that people have in terms of dealing with disability. And sometimes there are technical reports that are taken into account or were made, decisions that are made having to do with families or raising children, and the right that women have to have children and to live with their family of origin. So that is something that is very important. It's something that has received a lot of attention over the years. It's something that Uruguay is giving special attention to so as to provide support for child raising and all of this to uphold the rights of women with disability. Now, I was mentioning some of the difficulties that women with disabilities face, and those barriers are made even worse by the pandemic. It's already hard for people with a disability to access services that are related to health or to the services having to do with gender identity, viability. And of course, the pandemic has worsened that situation, having an impact on families in terms of suspending therapy, canceling appointments, or creating uncertainty. All of that was affected by the pandemic. Now, definitely transportation. Transportation was also disrupted, making these barriers even worse. And all of this had to do with an increase in gender violence and sexual violence, things happening within the household, because women, when they go to health services, often that is the first time that they dare to talk about the situation they're experiencing at home. And for months, they were not able to access these services having to do with health and with gender-based violence. It's important to say that we work jointly with civil society that works in the area of disability, and we try to work with women with disabilities. In the project, I was telling you that we work with one of our key partners, and that was the Pan American Health Organization. We created groups of women that work. These are women with disability, and they, for a long time, have been advocates, and they refer to this. They talk about the need to be heard, to being protagonists of their own lives. And here it is important to realize that we want to tear down all of these attitudinal barriers and the attitudes that exist in all of our countries. So there is definitely that need to progress so as to achieve the inclusion that we want. And here I would like to refer to the fact that, of course, in terms of employability, that is a key aspect of any desire to lead an independent life. Without education, without a job, it's impossible to live independently. So we have a unit that works with employability that has to do with economic self-sufficiency. And also it shows how important it is for women with a disability to be able to play a role in the labor market. They need to be participants in society and in the labor market. And the state needs to create conditions so as to pave the way to obtaining those goals. So I will be sharing my presentation with you. The idea of this video conferences was to cover the two areas that we're involved in. This has to do with economic realities, employment, and the reality of these women with disabilities. A lot has to do with gender policy, care, and also women with disability definitely have a lot to accomplish in the area of guaranteeing their rights. Thank you very much, Dr. Sass. Thank you for a very good presentation and for sharing with us this perspective, this vision of the government's plan and the response of the government. Also, this will enrich the thinking in this area by all. Thank you for talking to us about the historic situation of women. Women definitely do have a struggle, but also they have the possibility, the desire to progress. So thanks to people like you, we are on the right track. So thank you. Thank you for your presentation. And I wanted to remind you that there is a simultaneous interpretation. You can click at the bottom of your screen on the icon that says interpretation, and there you can hear English or Spanish. I'm sorry to make this announcement so late.
Would like to share with you a video that was prepared for International Women's Day. We have enjoyed preparing it and we hope that you will enjoy sharing it with us. El video, por favor.
The pandemic has impacted many, but not everyone in the same way. Women and girls of all ages weathered the crisis with increased caring responsibilities resulting from unequal gender roles.
The 19 pandemic has been difficult on us all, especially on our young people. It has affected our educational system. Students, both old and young, became subject to learning remotely. Not being able to socialize with our friends, with our peers, with our loved ones has affected us mentally and emotionally.
In the region of the Americas, over 10,000 healthcare workers lost their lives responding to COVID-19, many of which were women who comprise 70% of the frontline care and represent only 25% of managerial positions. Yet, men have shown higher mortality rates due to COVID-19, including disproportionate infection and deaths in certain ethnic groups. Gender and masculinities shape their health outcomes and that of those around them.
La pandemia del COVID puso a prueba el mandato de la masculinidad que nos dice a los hombres tienes que ser libre y estar fuera del espacio
There are
doméstico.
subtitles, so the interpreters are not interpreting this video.
Tensión, irritabilidad, frustraciones, enojos, malestares que los hombres aprendimos a no expresar, a acumularlos. Ante esto, los papás podemos aprender a ser afectivos, asertivos y diversos en la expresión de nuestras emociones y malestares a través de ser corresponsables, afectuosos, procurar cuidados, tiempos, comunicación con respeto.
A reality of our region is that pre-existing systemic inequalities endanger COVID-19 health outcomes and affect the resiliency and recovery of communities and countries. In our response to the pandemic, only 24% of women sit on national task force, whereas they are responsible for 80% of domestic tasks, including caregiving. Ensuring gender equality in care economies must be the foundation of building resiliency and sustainability.
Do we even know the true impact of the pandemic on women? We need to be in the know. And moreover, you and I must be the champions for the universal elimination of gender and health inequities during pandemics and beyond. I know that there can be no sustainable development without gender equality.
Thank you very much. We hope you enjoyed the video. At this moment, I would like to welcome His Excellency Ambassador Hugh Adsett, Permanent Representative of Canada to the OAS. His Excellency is Ambassador and Permanent Representative of Canada to the Organization of American States in Washington, D.C. He has served the Department of Foreign Affairs and International Trade in Canada. He worked in the Peace Building Division and the Human Rights Law section in the Legal Affairs Bureau and served as Deputy Director of the Environmental Law section. Among other roles, he has also served in Addis Ababa at the United Nations. At the OAS, he assures Canada's commitment to diversity, inclusion of marginalized population, and gender equality, encouraging the active participation, leadership, and empowerment of women and girls. Ambassador Adsett is a tremendous friend and supporter of PAHO, and we thank you heartily for this, Ambassador. The organization works with Canada hand in hand, and of course, we share the agenda in regards to women's health, gender equity, and cultural diversity in the same dimension. We thank you for being here with us this evening. The floor is yours.
Well, thank you so much, Dr. Watson. It's really me who should be thanking you and thanking the colleagues that are here this afternoon and thanking PAHO for its significant work and its contributions. I think we work hand in hand because we share so much in common, including common objectives, not only on health, but common objectives on gender equality as well. And I know that's the topic, of course, today of our discussion, but let me first start, as I say, not only by thanking you, Dr. Watson, but also thanking the director, of course, Dr. Etienne, the deputy director, Lou Valdez, and our panelists as well, Dr. Sass, and I know we're going to hear from Dr. Barbosa a bit later on this afternoon too. And I think it's important that we take a moment today to reflect, as we have started to do already, on the significance of this discussion on gender equality in health, an issue that's as urgent as it is important. Countries in the hemisphere, and this has come up already in our discussions this afternoon, continue to grapple with the most acute impacts of the pandemic. Challenges include those related to high rates of infection and hospitalization, access to vaccines and therapeutics, and exhaustion of healthcare personnel. And so as we're faced with all of these challenges, today provides us a little bit of an opportunity to look to the future and also perhaps just to seek some longer term solutions based on what we may have learned already. So this afternoon, already heard some very compelling discussions and comments that have been made by those who've had a chance to speak so far. And a point has come across, I think, that's been made clear throughout, which is that this pandemic has tested the capacity of healthcare systems like never before. Building more equitable and resilient health systems has never been more important. We come from a region that has been noted already today is amongst the most unequal in the world when it comes to wealth distribution. And this has meant that working together to ensure that health systems and services are designed to reach even the poorest and most marginalized communities becomes ever more important. For Canada, we are very much a firm believer in the idea that putting gender equality and the empowerment of women and girls in all of their diversity must be at the heart of our public policies. It's the most effective way to build more inclusive and prosperous societies. When it comes to building stronger health systems and producing better health outcomes for our citizens, there's no doubt gender is one of the key determinants which must form part of our analysis and also inform our policies going forward. We are very fortunate to have this report that was launched today by Dr. Etienne, the gendered analysis of the COVID-19 pandemic. This makes a very important contribution to our understanding of the relationship between gender and health, and also lays down a promising path for the pursuit of health resilience in our region. Dr. Etienne, when I was listening to the video, you had a quote, or I'm going to quote you, you had said that there can be no sustainable development without gender equality. And I think that's an important point for us to highlight. Deputy Director Lou Valdez, you also said too that the pandemic has had a disproportionate impact on the health of women and girls, and others made that comment as well. If the pandemic had given the slow burning embers of inequality, it's as if the pandemic has given the slow burning embers of inequality more oxygen, igniting the health risks faced by women and girls like never before. And this has been something that's been striking in what we have seen, and I think an important fact for us to accept and to do better with in the future. In particular, should lead us to the conclusion that national pandemic responses that integrate gender equity and equality would be much more effective and would achieve higher standards than those that focus strictly on epidemiological criteria. The study that was presented, the PAHO study, points us in that very direction. We know as well it's a complex relationship. And here's a point I wanted to highlight in particular this afternoon. A complex relationship and underlines that only high quality research supported by a robust evidence base can properly help us to unpack the complexity of some of these relationships. To that end, we need data that is appropriately disaggregated. And for Canada, this is something that we've come to recognize, the importance and value of data disaggregated by sex, by gender, by ethnicity, by age, amongst other criteria. Various factors represent the intersecting dimensions of the identity of women and girls, each of which can lead to discrimination and inequality. Data that can adequately capture this complex reality, the complex reality that women and girls face, is key to supporting the development of gender responsive policies, particularly as it relates to COVID and to health access. There are gaps currently in gender statistics, which can make it difficult to obtain the full picture. A lack of disaggregated data that reflects the diverse experiences of women and girls, in particular those facing intersecting forms of discrimination, will have consequences for healthcare policy by ultimately affecting priority setting and the allocation of resources. So here's a challenge we have to help address this. Canada's investing $5 million through the OECD's Paris 21 initiative. This initiative is to enhance the capacity of national statistical offices to generate and work with high quality gender disaggregated data. And the aim of the investment is to improve both the quality and availability of gender disaggregated data in order to foster more inclusive, effective, and evidence-based decision-making. And I think these were points touched on by Dr. Sass as well in her presentation. A couple of final words. Health systems are straining to respond adequately to the pandemic, but the need to protect comprehensive health access, including to safe abortion, contraception, and other sexual and reproductive health services, is more important than ever to ensure that women and girls have control over their bodily autonomy and do not face additional vulnerabilities, discrimination, and violation of their rights. Canada will continue to support the important work of our partners who are ensuring that quality health services remain available and accessible to all, especially women and girls, in all of their diversity. Canada also remains committed to its feminist international assistance policy, which has been instrumental in shaping how our COVID-19 response and recovery plans have taken gender equality outcomes into consideration. The pandemic has brought gender disparities into sharp focus, and we will continue to be driven by the need to always do more and to always do better. So let me close by thanking you once again for the opportunity. It's always inspiring for me personally to have a chance to participate in the events that PAHO puts on. I'm struck by the tremendous leadership that your organization has shown, and I'm very grateful for the opportunity for us to make a small contribution to it. Thank you very much.
Thank you very much, Your Excellency. It has been a privilege and honor to have you on this panel and to also be able to share your timeful insights and contribution on the relation between international cooperation and gender equality in health. The partnership with PAHO has been a strong, robust process, one from which we are also learning. And I want to reiterate our thanks and the commitment that you have expressed in regards to this topic that joins us together today, that convenes us today. We know there's a long road to go, but I'm sure with partners like the government of Canada and with the commitment of yourself, we will get there to improve the health of our women in this region. Thank you very much. I would like to apologize for Dr. Sash. She had to run to another commitment, but she expressed her thanks and her regards to all the participants, particularly to the organization, and remains available for other moments in which her competencies and skills can be also of contribution to her work. Last but not last, I would like to invite our Assistant Director, Dr. Jarvis Barbosa, for the closing remarks. Dr. Barbosa is the Assistant Director of PAHO. He has extensive experience in public health, epidemiology, health surveillance, health analysis, management and regulatory system. As the Assistant Director, he oversees the organization's core programs for technical cooperation with its member states. Dr. Jarvis Barbosa is also a strong supporter in regards to our topics on ethnicity, gender, human rights, and cultural diversity, one that he has expressed all the time that we know is on the agenda of a programmatic response, and collaborates closely with all the interventions and programs that are on the floor. We thank you, Dr. Jarbosa, for your support, and I invite you to take the floor. Thank you.
Thank you, Gina. It's a great honor to participate, and I want to first our Madam Director, Didi, our colleagues from PAHO, colleagues from the Ministries of Health, NGOs, civil society. I think that all that are participating in this very important moment to celebrate, to highlight the problems, and to think about how we can present a common response in the Americas, mainly in the Latin America and the Caribbean, to this very important topic that is how to achieve equality on gender. I would like to thank the different panelists, ladies and gentlemen, PAHO colleagues. I'm very pleased to have been a part of today's insightful discussion. It's a privilege for me, on behalf of the Pan American Health Organization, to comment briefly on the panel so richly developed by our diverse leaders. All this information is timely and critical to tell the full story of the pandemic, its evolution and its recovery, alongside the urgency for sustainable gender equality in our region. Today, you have heard about the central role of gender equality in determining health, well-being, and access to social protection. PAHO's report, Gender Analysis in Health, COVID-19 in the Americas, has a wealth of information available for your further consultation. The compelling perspectives from Uruguay and the strong vision of partnership from Canada show but a sample of how national frameworks and feminist policies make a difference in advancing the enjoyment of the best possible health for all. Other initiatives exist in our region. However, I am compelled to emphasize the care economy agenda as the disproportionate burden of caregiving placed on women has had, and is having an exorbitant cost on their physical and mental health. The pandemic also warrants, as mentioned by all panelists, a radical transformation on the generation, analysis, and use of disaggregated data to identify inequalities in health. From my perspective, without quantitative and qualitative data and evidence, our agenda and other health equity efforts are significantly impaired. We must closely monitor and accelerate the actions to close the gender gaps for sustainable development. As of mid-February, over 1.5 million COVID-19 cases have been reported among healthcare workers, with women accounting for 73% of those cases. We really must do more. PAHO is proud to have a clearly defined gender equality policy, which mandates us, the Secretariat, and the countries of our region to constantly assess and redirect actions to ensure that women and men have equal opportunities for good health outcomes. Today's panelists expertly walk us through the many issues impacting women's health and well-being in the context of the pandemic and beyond. Rest assured that I will not repeat the critical points raised. I will, however, underscore PAHO's vision and commitment for gender equality in health. I now wish to share two new concepts generated by the pandemic related to our discussions today for our reflection. The first has to do with the direct contribution of women to upholding our healthcare system, our homes, and our informal economy. These contributions alone are immeasurable. This is where the concept Sheroes was born. Women in every corner of our Americas and the world at the center of the pandemic. The second concept is economic, perhaps socio-economic by extension. In 2019, in Latin America and the Caribbean, 29% of women had no income of their own, compared to 10% of men. Additionally, women perform 80% of care work, limiting their participation in paid work, and they were significantly impacted in job loss during the pandemic. This reality gave birth to the concept secession. As seen in our short but precise video, PAHO stands firm in its conviction. Without gender equality, there is no sustainable development. My sincere thanks and congratulations to our panelists who have shared their expertise with us on International Women's Day. We take note of the many ideas and suggestions from your experience, and we are committed to championing the rights and contributions of women in health development and beyond. We do this by taking bold actions to transform systemic gender inequalities, placing the care economy at the center of recovery, using evidence, building resilience, and ensuring women's leadership at all levels of society. I also would like to thank those behind the scenes who work hard to bring us all together. I invite everyone to continue to champion gender equality in their individual, those in our lives, and those throughout our region. You have our renewed commitment. Thank you.
You're on mute, Gina. This little button always gives me problems. Sorry, Director. I was saying thank you very much, Dr. Barbosa, for a superb wrap-up in closing this session. More so your commitment to the health of our women, of achieving equality in health for all. We are sure that the organization has a strong commitment and has also expressed it. It's part of the director's legacy. Though there is a long way to go also, but with partners like the Government of Canada and with the support and participation of all those who have been here this morning, with the support also of Mary Lou, we are on the road to get there. We are much better than we were 100 years ago, and there's no doubt in the next coming decades, we will be better. And PAHO will be to thank for a lot of that, for long hours, commitment, and the evidence to move forward. Before I close, I would like to ask you to please keep open your cameras so we can have a group photo of the panelists. And also we would ask the participants in general to open their cameras a minute after for a group photo of this session. I thank you for all your participation, or distinguished panelists. It has been my privilege and my honor
Okay, give me
to
a
moderate this
second,
session and to
please.
listen to you. Thank you.
Okay, looking at the camera. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. Perfect.
We would like to invite all the participants, 200 and something participants, to open their cameras so we can have a general photo of the group. Thank you. Have a blessed day and have a great evening.
Okay, just a second. One more time.